So here's a patient who's presenting with right-sided pelvic pain. Now, obviously, there are a number of different diagnostic considerations you could have when evaluating these patients, but this patient had a fever, was doing very poorly, was very sick, and had an underlying history of HIV. Now, as you can see on these images, there's marked bone marrow edema throughout the right hemipelvis, particularly on both sides of the sacroiliac joint. T2 bright, T1 hypointense, and you can see that there's abnormal enhancement associated with the right sacroiliac joint. Just as concerning, on both the CT and T2 weighted images, you can see that there's actually a fluid collection directly extending outwards from the right sacroiliac joint anteriorly. Now, whenever you see that constellation of findings, bone marrow edema, fluid in the joint, fluid collection in contiguity with the joint, you have to worry about septic sacroiliitis. And in this case, this turned out to be an unusual case of TB sacroiliitis. And if you looked up at the lungs, this patient had extensive lung disease, suggesting that the patient had active pulmonary TB as well. So anytime you see unilateral sacroiliitis, at least consider the possibility that you could be dealing with an infection.